Wear your mask, right, Zorba?
Yeah, we're taking your questions now for Dr. Zorba Paster.
270-9933 is the number to call, and we'll start with Jeannie in Prairie du Sac. Hi, Jeannie. Jeannie, you there? Okay, I don't think Jeannie is there. So let's go to Donna in Lake Mills. Hi, Donna. I don't think our phone is working.
Oh, no.
Donna, you there?
I'm here.
Oh, there you go. Thank goodness.
What's your question?
I hear about lung transplants for vapor patients and for for the COVID patients, but I don't hear anything about transplant availability for COPD patients.
Well, some patients with COPD do have certain lung operations. They're not necessarily transplants. There are other operations where they actually reduce the volume of the lung, but transplants, very, very difficult operation. You've got to be healthy, and I'm not exactly sure where they fit in with COPD, but they do fit in with some COPD patients. The issue is making sure that you really don't smoke and get it in the first place, or if you do smoke, the other surgical procedures that may work for you, such as lung reduction in volume, really can be effective in end-stage COPD.
All right, let's go to Ann in Stoughton. Hi, Ann. What's your question?
Hi. I have a question about vitamins. Hi.
Go ahead. We hear you.
In the stores, they sell vitamins like one a day for men's and for women's, it says on the bottle. But is there really a difference between them? And is there any harm if a man takes women's or vice versa? Thank you.
Not at all. There really is no difference between their vitamins. It's really more of a marketing technique. They'll say, well, a little bit more of this or a little bit more of that. A once-a-day multivitamin, if you're going to take it, is all you need, but is no substitute for good eating, lots of fruits and vegetables. And by the way, winter's coming on. Vitamin D, I think, is something we really all ought to consider, especially since there's new information that shows that it may be one of the issues with COVID. And the issue is whether or not you ought to take 2,000 units or 5,000 units a day. That's an individual vitamin. The multivitamins do not have enough vitamin D in them. You have to take a separate vitamin D. Should be D3, inexpensive, easy to get over the counter.
Yep, I take it too. All right, let's go to Mike in Sun Prairie. Hi, Mike.
Hi. Yeah, Dr. Zorba, I went on the internet and seen that CDC came out with a graph last week where from ages 19 to 0, or from 19 and under, they said you have a 0 chance of dying from COVID. And yet last year, 78 children died from influenza.
Yeah, well, first of all, I'm not exactly sure about that CDC graph. I'd have to look at it. And there are people under the age of 19 who I believe have died from COVID. I'd have to look that up and see what it is. Doesn't mean you're not at risk. Doesn't mean that you're not at risk for side effects of COVID later on. There's recently a study that looked at college football players and myocarditis, which is an inflammation of the heart when they get COVID. So even though you may be asymptomatic now, you may be symptomatic later on. So don't think for an instant that just because you're younger and you get COVID does not mean you will not have side effects 5, 10, 15, or 20 years down the line. We know there are viral illnesses such as HPV that can cause side effects years later.
All right, let's go to Christopher in Adams Friendship. Hi, Christopher. What's your question?
I was going to see, my cousin had coronavirus, and he spent 2 weeks in the hospital, and I just seen him not too long ago, and I wanted to know if he was still contagious or not.
Usually, you're not contagious after 2 weeks. Once you get it, 2 weeks later, that's the period of contagion. That's what the CDC recommends, and that still seems to be the standard of care.
All right, let's go to Chuck now in Monroe. Hi, Chuck.
Hi.
What's your question?
Hi.
Yeah, I was wondering if it's possible for us to get the spit test that they're using for the NBA bubble or the University of Illinois.
Yeah, I don't really know what exactly. There's a saliva test for COVID. I don't know if it's available in your area. I know that in Madison, the Alliant Energy Center, it's drive-in, easy to do, takes about 15 minutes. In Monroe, I don't know exactly where the center is where you can get free testing. I would recommend call your doc, call the office, find out where you can get free testing. The test of the nasal swab is not that bad. All tests have positives and negatives, and I don't know if the Swift test or the spit test is as good as the nasal swab.
Yeah, we don't know. A lot of questions about this disease. Every day something comes up.
Let's go to Mark.
No, we're not. They hung up.
Oh, okay.
We don't have a call.
Oh, okay.
Right now. So, bottom line, this is far from over.
Of course, it's far from over. And when we look from a point of view of a vaccine, we're looking at the first or second quarter of next year. Once a vaccine comes out, then it's got to be rolled out. Then you've got to make sure that people are interested in taking it. And it's just like it is with every other pandemic. It takes a while before the public really gets involved with these things and becomes involved. A vaccine is really when this is going to be over.
We hear talks that maybe before the election.
There are talks before the election, but if you look at Dr. Anthony Fauci, he said very unlikely before the election, and that means very unlikely before the election. In other words, we don't want to rush to judgment. It's important to make sure the safety is there because everyone's got to make sure it's safe or they're not going to take it.
That's the bottom line. All right, Zorba, thank you.
Thanks for your time, Zorba. Great to see you.
Thank you.
Great to see you guys.
Thank you all for calling in. We'll have a final check of your forecast coming up.